Hi, everybody. Welcome to the town hall. We're going to start in just a little bit. So make sure to click the share button wherever you are. If you're on Twitter, retweet, I don't know, whatever you do, wherever you're watching from. If you're on the website at eladgross.live, you can also just share that link with your friends. Anyway, share the thing. Get your questions ready. We'll be back in just a moment. Welcome to the town hall. We're very excited to have you all tonight. Make sure if you're here, let us know where you're here from. This is very exciting because Bridget is an absolutely wonderful candidate for state representative. And we've gotten to see quite a bit of each other back in the days before the virus, running around the state a bit. So you're running for the 93rd state representative. I'm running for attorney general, for those of you who do not know. My name's Elad Gross, and this is Bridget Walsh Moore. And so we are super excited to have you. We've done a few of these town halls already. And I think they're all pretty interesting. Folks get to learn more about the candidates that we've got, who's running, why they're running. And even folks who are from different parts of the state, I think, get to learn a lot about each other in ways that we can really support everybody in Missouri. So excited to have you on. How are you doing today?
I'm doing well, thanks. Can't complain. Congratulations to you, the man of the hour, after successfully suing the governor. Way to go!
Yeah, that was some news today. For those of you who haven't been following, it's now in the Post-Dispatch and the AP, and there's been some student journalists calling too. But yeah, there was a lawsuit that I brought against Missouri's governor, actually the governor's office. Was to defend Missouri Sunshine Law, which is our public records transparency law. And I've been opposed by our current attorney general, the guy I'm running against. He's not the biggest fan of government transparency, and took us to the Court of Appeals, where we got a good ruling, and thankfully we'll have some transparency in our government. Now, lots more to do, which is why the legislature is such an important place to have good people elected, because we've got to get some better laws on the books to make sure we're holding people accountable. So
agreed. No, I agree more.
Well, tell us a bit about you. Like, why are you running? Who are you? What you doing? Why should everybody trust you? I do. So I can vouch for you all day. But let's win some voters for you.
Appreciate that. Well, as you said, thank you for having me. My name's Bridget Walsh Moore. I am running for state representative in the 93rd district, St. Louis, born and raised. And I'm now live in South County with my husband, Greg, where I have a degree in international studies from the Institute for International Studies at Bradley University. I also studied Arabic at the American University in Cairo, Egypt. And then I came home after school. I took a job with Bissinger's Handcrafted Chocolatier, great local company. And I was able to, through that position, I was able to learn a lot, but also I co-founded the North Broadway Business Development Community to improve the area around North Broadway. It's in need of some work. And I've earned a certificate in international trade through the World Trade Center in UMSL, and I was able to use that to segue my career into customs brokerage. So I was at the heart of the China tariffs going on all last year, making everyone's life a nightmare. And that gave me great insight into the economic relationship between China and Missouri, and it was a valuable insight to segue into moving into an elected position.
How this is, you're the first guest with this this kind of a background. How do you how okay, so how in the world, so you're going from international relations, you're traveling, you've learned Arabic, how do you go from that to local business development?
It's easy. The State Department wasn't hiring when I graduated. That's how you do it.
Yeah, that's fair. Yeah.
You're at home, you need a job. So I was fortunate. I took on basically just a seasonal position, just like I'm out of college. I need a job. I was hired by Bissenders. It was a great learning experience. I had just a sales position there. I was able to just move up through the ranks when I left last year, 2 years ago, I guess now. I was able to become the executive assistant by the time I left. So I had a hand in pretty much everything. I never thought I would learn about, manufacturing, running a warehouse, any of that. But it was great. It was like business school through doing. And when Bissenders purchased the factory on North Broadway, because they were very committed to the city and keeping manufacturing in the city, I had a part in the development of that building and the historical tax credits and everything that went along with it. So it was a great experience that I enjoyed.
Yeah. Well, I think it's probably, especially right now, given everything that our state is facing in our country, it's probably great to have somebody with that background making policy decisions, especially given how closely you've worked with, or at least knowing how small businesses have to deal with these kinds of situations, what kind of, administrative or even local opportunities there are for folks. Are you seeing, I guess, looking around at what's happening right now, are you seeing that experience that you've had translate into something in your mind about policy or what Missouri could be doing better for small business owners right now?
In terms of policy, I think it's round to, it's a multifaceted issue, especially in the city and some of the areas right outside the city, which is what the 93rd district is. It's just right outside the city. It's been underdeveloped. It has been somewhat ignored, I think, by prior officials and just kind of left behind. So part of that is building the small businesses, developing the areas, bringing in restaurants, shops, what have you. And a lot of that is improving the education, which the 93rd actually has several school districts within it. It has Melville, Afton, Bayless, Hancock, and the St. Louis City Public Schools. So some really amazing school systems, and then some that still need a lot of work. Mm-hmm. So I think it goes back to, it goes hand in hand. Why won't people go to the city or just outside the city? And in Lima, a lot of it's, it's crime. Okay, well, what stops crime is foot traffic. So you bring in business, but you can't bring in business if there's crime. And how do you get people to go there? Well, a good education system. Well, you can't support a good education system without a strong business. So it's a multifaceted approach that you really have to take, addressing all of the issues. And in Lima in particular, it's also an environmental issue. We have consistent floods. Then you can't ask someone to move into a floodplain. And so we need to work with the county and probably on the federal level is where I'm looking to get some support to build up that area into some of it has become a park, but the river isn't going anywhere. It's definitely expanding. Yeah. And we need to be prepared for that. So spring didn't care that we were under quarantine and that it was flooded. So, yeah.
Right. And flooding has been a major issue really throughout the state. And for those of you who do not know, you did mention St. Louis City, which was good. But yes, this is in the St. Louis area in Missouri. It sounds like the district, with all of the different school districts involved, it sounds like it's a pretty diverse area in terms of, I mean, so much, right? Probably in terms of opportunity for a lot of folks. And so I guess, what has been your experience before having to do everything virtually, but just, traveling in the district and seeing the different experiences that folks have you seen an underlying theme for folks or something that people in general really want to be dealt with no matter where they're living in the district?
A lot of it is business development.
Mm-hmm.
That area, it is definitely a small business centered community in Limay and Afton and in South City. The Patch is coming back. They have Stacked. They have Perennial Brewing. They have Counter Kitchen. It's definitely, they're very proud. That's definitely the underlying. I know when we talk about all these different school districts and all these areas, it sounds like the geographic area must be so big. I can traverse the whole thing in 15 minutes. It's a tiny little area of South County and South City. And that's another challenge for a state representative is I have the city and the county. So that's a unique position to be in, and that's more convoluted local government. But it's great. I grew up in the county and I lived in the city for a while until I became disabled, and the city was not able to accommodate me, which is another issue that I'm working on is disability rights. That's a strong pillar of my campaign.
Yeah. Can you? I know. I mean, Rasheen Aldridge, who's a state representative, and he's been working a lot on these issues too. I mean, what I guess, yeah. No, I was talking to a young man in Kansas City who has been really working on a lot of these issues. He became paralyzed, and he actually is as an avid weightlifter, and he's working in gyms and in different kinds of things and trying to get more young folks involved. And he's working a lot on the sidewalks and accessibility issues. I mean, it sounds like that, like you said, it's a big issue for you personally, but also for folks in this state. Tell us more about that. Like what kinds of things are you working on? What things have you experienced that could be better, for folks in Missouri, for us to be focusing on as eventual policymakers, knock on wood.
Yes, fingers crossed. Well, one of the main things you mentioned is infrastructure. So a little background on me, I am a cancer survivor. I had osteosarcoma. I was diagnosed in April of 2014, and a stage 3B osteosarcoma, which means we caught it right before there was no turning back. So I'm fortunate. I'm extremely lucky. And unfortunately, that did cost me my right leg and hip. I had a calcified tumor in my right hip. So unfortunately, the whole right half of my pelvis had to go, and the leg had to go with it. So overnight, I became a person with a disability, I was 26 when I was amputated. So I lived my whole life, quote unquote, normally, able-bodied, and this was quite an eye-opener. For a long time after my surgery, I used a wheelchair, and as many people do, and it really brought my attention to just the lack of sidewalks. Or when a sidewalk is there, it's crumbled mess, and you can't get through it, and it creates another barrier. Or curb cutouts that open directly into the street, and you have to walk, or you have to wheel around in order to get to the sidewalk. It's a major problem. And we're also Metrolink and bus expansion. It's a major problem. But some of the things specifically that I am hoping to fix, one of my pet projects is going to be to keep people with disabilities out of institutions and keep them at home if that is their wish. At the moment, the way we have Medicaid set up, you can earn only so much money. It's correct. Don't hold me to this, but it's about $35,000. It's not an insane amount of money, and it's not a ton of money. And once you hit that salary cap, you lose all of your disability benefits, all of them. So you're stuck in this catch-22 of, well, I'm making good money and I can live on my own, but I have a lot of medications, or specifically I'm able to work because I have the use of an aide. I have someone who comes in the morning, in the evening, who just kind of helps me do the bed routine and whatever. Other than that, I'm completely self-sufficient, but I need a little help in the morning and the evening, and I cannot afford to pay that person out of pocket. But now I'm making too much money, and so that person is gone, which means, one of the bittersweet things of the COVID-19 pandemic is that overnight the world became mobile. It went online. All these jobs that you were told forever and ever, there's no way you could work from home. There's no way you could do this job remotely. All of a sudden you can. And so I say it's bittersweet because it's a frustrating for those of us with disabilities who were told, oh, you can't possibly work in this field or do this, that, and the other thing. And all of a sudden, night you can, which is great if we take this information, we take this as a learning opportunity, and we do expand either partially working remotely or whatever to incorporate more people with disabilities into the workforce.
Right.
And the last thing that is really one of a hill I'll die on kind of thing is the sub-minimum wage. It needs to go. Shelter workshops and the sub-minimum wage. Minimum wage is minimum wage. It doesn't, there's no asterisk at the end that says only some people. It's ending the sub-minimum wage is one of my main causes.
Yeah, let's talk about those two things. First, I'll say I think it's a great point that a lot of, and it's not all jobs, right? A lot of folks, I saw a chart today about, depending, we're looking at education levels in America. And if you have advanced degrees or you've gone to college, just going to college already makes it way more likely during this whole crisis that you've been able to work from home. Folks who have a high school diploma or less, the vast majority of them have had to go into work and oftentimes even risk their health. We saw this happen in Springfield with a couple of folks who were cutting hair and they were going to work because they had to, but they were sick and they infect other folks or at least have that risk of doing that. So, there's a lot of issues right there just in terms of equity and making sure that folks have opportunity and really, just like you said, education and quality education. But it's interesting just from like a legal perspective for jobs that have said, like, just like you pointed out, that have said that, oh, we can't do this. We can't accommodate folks. We can't do this from home or whatever it might be. This is really going to change, I think, a lot of how folks are seeing the workplace and what people can do from home and from different locations. And it can certainly strengthen people's rights in the workplace in a lot of ways, even after this is all done.
It can be done.
Yeah.
A lot of those. And the frustrating thing is we already knew that.
Right.
We already knew. It's like,
right.
You can't possibly work from home. You can't. Yes, you can. And this is just finally proven the point.
Right. Yeah. There's these amazing things called computers and phones, and we have them. You don't even need to have the phone in the wall anymore for most of the day. So, technology has it's been there. The things that we're using right now to communicate with all of you, they've been there. It's just at least there's now an awareness around that, which I think is a good thing. And then so now the last point that you had there was about sheltered workshops, and I don't know how many folks are familiar. I know some people are very familiar with those, especially if they have family members that might be working in one. But could you tell us more about what is a sheltered workshop? And when you said sub-minimum wage, what do you even mean by that?
A sheltered workshop, just very broadly, is a place for people with disabilities to go and basically try to earn a skill or to apply a skill set to do a job. Usually these are minor labor activities, usually very repetitive, basic skills that they could just do again and again for a long time. And when they're there, these individuals are earning below the minimum wage. The sub-minimum wage, I believe, it's under $1 an hour in some places. And so it's insulting. It's ridiculous. Some people do advocate for them, specifically families of the person with a disability, saying that, oh, it's just to fill time. It's just to give them something to do, to give them a sense of accomplishment. But if someone is going to do work, that work has value, period, paragraph. And we as a country, as a state, have already established that a person's work is worth minimum wage. We have said that. And so to go back and make exceptions and to say, you're basically saying that you're not really a full human, is what we're saying there. And that's something that I just cannot abide. And so that is something I will work to end in office.
Yeah, I know, we see this happening. And I mean, we just talk about the minimum wage in general. Certainly it's not a living wage, right? So whenever we're talking about, I mean, there's so many folks right now, and I know, I was out for a lot of the custodial workers in St. Louis City that were not getting paid a living wage, and they were able to increase the wages a bit. But yeah, I mean, folks are even talking about the $15 as the fight for 15. That was a fight that was started. Yeah, quite a while ago. And if you look at like even $15 per hour and what you can afford with that, it's not great. And, we're talking about housing costs that are still up, mostly because we're really not enforcing a lot of our housing laws and consumer protection laws in the state. You talk about access to credit and how hard it is, and, all of these stressors that are on folks. I mean, just like thinking that you have to fight so long just to get a little bit, and then by the time you get there, it's not enough, right? For what you had planned to do. Yeah, it's really frustrating, exactly. And it's unfortunate that in our state, on so many different levels. I mean, just from the minimum wage in general, which we did. Hey, by the way, we did increase as a state, and then the legislature tried to pull that back quite a bit. Yeah, that's what they do. But yeah, it's tough, and I think we're seeing that a lot from folks in Missouri in a lot of different ways. There's an argument on one side that's like, well, look, businesses need this in order to survive, and otherwise there won't be jobs for folks. On the other side, there's like, well, I got to live as a person, and I think that's pretty essential. We've had minimum wages for a long time in America, and it's something that protects the individual from people that can exploit them. And so I think that's certainly a good point for just a lot of folks around the state. So, yeah. So I mean, I think a lot of what we're talking about is just like protecting workers in general. Yeah. Is that a priority? It sounds like it is, and I already know who you are, but is that a priority for you? You think that you can get some stuff, or at least try to advocate for stuff? I know it's hard to get it done in Missouri's legislature.
Hard to get it done with the super majority, but yes, we are working on flipping that. So
yeah,
hopefully November. But yes, I'm incredibly pro-union. My first job was a union job at the Muni. It was the best first job ever, probably the best job I'll ever have. I'm going to be realistic. I got paid to watch shows at the Muni.
That's great.
I was an usher. I was a union usher. Of course, at 16, that meant nothing to me. I remember sitting in orientation, and they were like, this is your union rep, and they're there if you need anything. And I was like, yeah, okay, whatever. But I was actually injured on the job. And so when they were like, okay, this is what you need to do. How are you? Are you okay? What's going on? I was like, oh, this is what a union is. Like they're looking out for me. Not that, and the Muni was incredible. They're a great place to work. But I know a lot of places aren't. And so it was great to have, the collective being with that was a great to be a part of a union. And, yes, I will be not only just anti-right to work, but also all of the other little jabs at the unions that you kind of see. It's easy to come out and say, oh, I'm anti-right to work, but then there are all these other little things that kind of find their way into other bills, and so you have to be vigilant. And one of the main unions I'm hoping I can help is the teachers union. Education is extremely important to me. My mom was a teacher, my grandma was a teacher, and we're not paying them. And that's a big problem with our schools, is who wants to work for an industry where you don't get paid and you have long hours and it's stressful and you don't make any money. So one of the things I'm hoping to do is, and I may or may not get this done, but I'm at least trying, is to tie teachers' salaries to the administration. So that way you can't have, not school board members, but the school, the district administrator, superintendent, that's the word I'm looking for. Superintendent making 10 times what the average teacher does. And so I think that should be only a percentage. Superintendent is only a percentage over, sorry, I don't know what the percentage will be, but only a certain percentage over a teacher's salary. I also think we should have one-for-one reciprocity across the state. So currently the way it works is if you're in Melville School District and you work there for 10 years and then you get a job in Afton, you're only credited with your salary for 5 years because it's a 2-for-1 exchange. Afton is still getting a 10-year experienced teacher. And what other industry does that happen? You're an attorney. I work in custom brokerage. If we put 10 years experience on our resume, we expect to be paid accordingly. Not, you switch companies, you switch firms, so we're going to cut your experience in half. That makes no sense, and I don't understand how and why that works.
Yeah. It's a lot of folks are looking at the education system and they're wondering why are, certain, we have underperforming issues or whatever it is. And if you look, I've worked with schools for a long time, a lot of them in St. Louis City, but you got to pay your teachers. It's pretty simple. You just pay
That's all
them.
they want. They just want to get paid. Yeah. They're already doing it because they love it. They're already doing it for nothing.
Right.
Just give them more money.
Yes, because if you don't pay them, there's a certain level, and I experienced this having worked for the state. At the Attorney General's, I was an assistant attorney general, and our Attorney General's office is one of the lowest paid in the country for positions. I think Mississippi and us, it's like 50 or 49, but
always right to the bottom with Mississippi.
Mississippi is especially given their investment in public infrastructure, I should say. And it's sad because I've had friends who it's easy to go and get a job at a law firm or at some points depending on the economy, but
depending on what you graduate, to be fair.
But like at least when I worked there, it was fine. It wasn't that hard to do, and folks could get paid a whole lot more. But people who are working at the Attorney General's office, which is true about teachers, oftentimes in districts that are in need of excellent teachers and excellent interventions in general, is that it doesn't take very much to keep people there. Like, you might not pay them the same as a school district with a ton of money through property taxes and everything else, but if you give them a little bit of support so they're not super stressed out when they go home and they are able to do their job and they feel supported at work, that's the most important part, is just having that community of support from the administration everywhere else. If you don't have that, people burn out and they start to look for jobs in other places. And even if they never wanted to work in a school district that was already doing pretty well, now all of a sudden it's like, well, I can choose to either never teach anymore because I can't take this anymore, or I'm going to go to a different district that's going to pay me and support me better. We look at teacher salaries in specific districts, especially ones that aren't doing too well, and they're lower, especially when you're starting. You're just not getting paid that much money. I agree. If you can go fix that, please fix that.
I will do my best.
Great, super. Yeah, I know the State Board of Education has been proposing increases there, and hopefully folks are listening. So that would be helpful. If you're out there and you can do something about this, please pay our teachers. That would be great. No, we'd all benefit.
Teachers, just make it so they don't have to buy supplies out of their own pocket.
Yeah.
Like, they're not asking for much.
Right. And that's a very
teachers happy.
very big issue. And for teachers who are, participating in different kinds of, we learn new stuff and we try to implement new things in our classroom. And, I've taught for a long time. And when you're teaching, not all kids respond the same way. And there are now, folks talking about creative classrooms and project-based learning and PBIS, which is positive behavioral incentive system. But that, you have to have things to do that. You have to have things around you to be able to do that. And a teacher who cares, who's in there for the right reason, is going to go, and most likely they're going to look at it and they're going to say, I'm just going to go get this stuff. And it happens so much throughout our country, but especially in our state right now, because we're not supporting them. We don't give them enough money to do it. So, yeah, it's a problem. Okay, so we've ranted about education. We talked about minimum wage and labor. We've talked about making sure our infrastructure is working for folks who certainly need it so they can get around. We've talked about even labor rights with everything else. So, folks, if you've got questions, go ahead and post them. I am looking at my phone for texts as they come in. But if you're on Facebook, if you're on Twitter, even if you're on YouTube, you can go ahead and type in your question, and we'll get it looking out. So I know some folks are watching, and that's great. Thank you for being here. Oh, Kendall. Oh, wonderful. Hopefully you'll get to work with Kendall over in Jefferson City. Kendall, hi. Thanks for coming. So are there any other major issues that you have seen or been speaking about outside of the ones that we've already covered? Is there anything that I'm just like, oh yeah, we need to talk about that a lot because I'm really excited about it?
It's usually the first one I talk about, and I touched on it briefly, but healthcare.
Yeah.
We could spend another hour ranting about healthcare. Again, as a cancer survivor and an amputee, I saw the deeply flawed system we have. Again, I was one of the lucky ones. I was able to keep working throughout chemo. Usually it was basically because of Bissinger's generosity. I was able to keep working and to keep my benefits. It was definitely a godsend for me. As a 26-year-old, I had to move back in with my parents. I was a mess. I was newly amputated and adjusting to a life, and still going to chemo and all the fun stuff that comes with going through chemo. So not having to worry about my medical bills too much was, that was everything. That I can't imagine going through that and worrying about, well, where is all this money going to come from?
Yeah.
Last year we lost tens of thousands of children. We lost them in the healthcare system. It's bureaucratic. And the governor says, well, yeah, we can put them on if they sign back up. So we've now put the burden on those individuals.
Oh, here goes my dog. She wants to get on the show. She'd like to be on the show. Hey, Ladybird. Come here, buddy. Come here. She doesn't want to come here. So what I'm going to do is I'm going to let you take over for a second. Oh, no, she is here. Hi. Come here, buddy. I don't know if do you have any furry friends at home?
Sorry, I do not. No, I am deathly allergic.
Okay. Oh, you're deathly allergic. Okay, wait. We can do this on the computer, though, right? Is it safe?
Yeah.
Yeah.
Yeah, this is safe. I think I'm safe.
You can
safe distance. Hi.
Pet the screen. This is Ladybird.
Yeah.
She usually sleeps during these things, but sometimes someone knocks on the door. She gets really excited, and you never know what happens.
I get this response all the time. People like me. No.
So we're sorry for interrupting. Yes. She's so sorry.
No, that's all right. That's all right. I was probably getting up on my soapbox too much.
No, you're doing a great job. Healthcare is extremely important. It's one of the biggest issues in our state right now. And it's a scary thing to not have it, especially when you're. Yeah, just like that can take because you're supposed to be healing. You're supposed to be dealing with all those situations and not having to wonder if when this is all done, you won't be able to afford anything, right? Like you're just going to be crushed by the end of it.
Right.
Yeah.
Like, how am I ever going to pay for anything ever again? It's definitely, that was, I was fortunate. It would upset me. I would be in chemo. Sometimes I was hospitalized for chemo treatment, so I'd be in the hospital for a week. So you get to know all your nurses really well.
Mm-hmm.
And I'd be working, and nurses would come in to check on me and say, "Oh, what are you doing? What are you?" I say, "Oh, I'm working. I got a deadline. I just got to do this." And the shock I was met with is what sticks with me. Just the, "Oh, you're still working? Your department wasn't downsized or anything. It's amazing what happens." They said I was one of the only people on. Now, keep in mind, this was the oncology ward at Barnes Jewish Hospital. So this is a big, it's Siteman Cancer Center. Lots and lots of patients. They said, "You're one of the few patients we know who's still working because they can, because they were kicked off their benefits or whatever." So that frustrated me beyond belief.
Yeah.
So that really kind of lit a fire under. And just when we learn about we're shutting down rural hospitals that are already extremely spaced out, they're few and far between, they're underfunded, and now we're just shutting them down completely.
Mm-hmm.
And of course, that leads to another major issue for me is our mother-herd mortality rate is dismal. Mm-hmm. We are ranked 46th nationwide in mother-herd mortality. It's a major problem, right?
Mm-hmm.
And I just don't see why we have more women dying today than were 10 years ago in childbirth and the following complications. That's not how the trajectory should go. So now we're losing even more women. And I know Representative Ashley Manlove has tried to put into the budget this past session, to do a study to figure out what is causing our mortality rate to be high, what can we do to stop it, and that bill was rejected from the budget committee. It did not make it in. So that's unacceptable, and that's something we need to change. We are also still the only state without an opioid registration program. So Missouri has become a destination for drug seekers, which ups our crime rate. It contributes to our unhoused population, and it drains our system. And because we are the only state that does not track opioid users. And the fact that we cannot get this done is, again, embarrassing and unacceptable.
Yeah, there was a few of these things were brought up in the legislature. I know maternal mortality, there's been some bipartisan work there at least, not enough certainly. But on the prescription drug monitoring program, PDMP as folks often call it, the problem is at the end of the session, folks were just dumping things into these massive bills, and thankfully, yeah, I mean, because we've got so St. Louis County has their own prescription drug monitoring program, and it does cover a bunch of the state. It doesn't cover everybody though, and I mean, it's folks are like, oh well. Because it's less about tracking people, it's more about making sure that folks aren't going from one place to the other and trying to get all that. It will literally save people's lives, so that medical professionals have more information. Yeah, it's a way to better address folks. Oh, I'm sorry. Yeah, you
cut out a little bit. Oh, I'm sorry. Okay. So that help?
This is good. Yeah.
Okay. Yeah. Sorry about that. Yeah, it would help with the opioid epidemic, and we have a major problem in this state. And yes, you're correct. The St. Louis County does have its own program, but it doesn't follow you everywhere. It doesn't hit everybody. So the fact that we have gaps is allowing this to continue. And I cannot stress enough, we are the only state without one. Literally every other state has done this. Yeah. So that makes us a destination for drug seekers, and that's not something we want to be.
Yeah, and it's one of the, so treatment is very important. And actually, right now, with all the opioid lawsuits that are ongoing, Missouri is at some point going to get, if there is a settlement, some kind of benefit. Now, it's very important to have an attorney general who's not going to treat this like some of these previous settlements we've had, like with tobacco, that haven't really gone to help people who are most in need. One of the things, and you've mentioned it already, and actually there's been some news about it, is Medicaid and Medicaid expansion. So right now, Missouri is one of the few states that has not expanded Medicaid. This was part of the Affordable Care Act. It gave the states the opportunity to actually get a whole bunch of money that we're already paying. We're already paying. It's our money. We're giving it to the federal government. It's going other places. And each state was able to expand Medicaid to make sure that the most vulnerable folks in those states could access affordable care. And in Missouri, that's about 200,000, maybe even a few more than that, 200,000 people. And one of the big benefits of Medicaid expansion, especially when it comes to opioids, is it expands the opportunities for treatment as well. But we haven't done that. And the news that happened today is that the governor, because folks signed, there's a lot of folks who signed the petition. Thank you if you collected signatures. Thank you if you signed it. Yes, signed it.
Everywhere.
Yes,
petitions everywhere.
Yeah, it went. So we had hundreds of thousands. It went over to the Secretary of State. The Secretary of State normally would take those signatures and would send it back to the local the election. Well, the Secretary of State in this case instead did random sampling of those signatures instead of sending them all back for verification. Which okay, all right, if that's okay. So I guess we're saving resources. He said he was doing it because we're close to a municipal election that we just moved. And then the governor, one would think that the Medicaid expansion vote would be in November when there's a whole lot of folks who come out and they turn out. He decided to assign it to the August primary, similar to what was done with Right to Work not long ago, to try to discourage a lot of folks from coming out and voting. But in my view, and I don't know what you think, but I guess we'll find out in a second. But in my view, whatever, fine. Let's vote twice. Let's go there in August. Let's get, right policies, decisions that our legislature will not make, and let's do it for them. Let's do what the governor won't do and expand Medicaid and make sure that folks can get health care during a pandemic. And then in November, let's go vote and make sure that we put the right people in the job so that they'll do it instead of us having to do it for them all the time. My view.
I agreed. I see you. Let's vote. Let's vote. Let's do it all day. Let's do it from home. I will raise you that. Yeah. Let's do it safely. Other states do it all the time. They've done it for years. They've had investigations into voter fraud, and they find minimal, if any. And so there's no reason we shouldn't do it. Scientists are predicting that we are going to have a second wave in the fall, so let's have safety measures in place so that everyone can vote. It is a right. Everyone says, oh, you can stand in line at the grocery store, you can stand in line at the voting booth. Not everyone's going to the grocery store. That's why services exist. You can't get the neighbor next door to go vote for you, so you have to. And it's your right to do so. So let's make it as simple and easy and safe as possible. But yes, back to your point, I was surprised / not surprised to see it on the August, where there's low voter turnout. Mm-hmm. People usually don't have the election on their mind in August. They're still enjoying their summer vacations. And so it does not surprise me that was when the governor chose to have our election our vote on Medicaid. It just tells us everyone get to the polls in August, and we can do it in August. We can do it in November. Let's just do it earlier. That's fine.
Yep.
Do it.
Yep.
Get it done in August.
And his explanation was, we need to know in advance. We need to know earlier in order to deal with, the budgetary, whatever it is. Actually, most of the studies have actually shown that it will have either little impact on Missouri's budget to expand Medicaid, or will actually save the state money, in a significant amount of money. And if you look at all of the ways that Medicaid the lack of expanding it has really impacted our state in so many ways we really don't account for. For example, you mentioned earlier rural hospitals that are closing. That's a very big deal. But when rural hospitals are trying to collect from people who are uninsured, they're going to court. And now the courts are having to have, staffing, and they're spending a whole lot of time on these cases. And so we're spending money on that too. And then eventually, you get a judgment against somebody who says, yeah, sure, I'll pay you whatever it is per month, but they can't afford it. And then the hospital's trying to collect from them, and there's nothing to collect from. And so eventually they don't have the money, and they're in bad situations. And so we have really weakened our healthcare system because we haven't expanded Medicaid, and we've taken so long to do that. So that's a very big issue. Esther, who's watching, she had a comment that I think goes right to the discussion about voting and voting safely. But she's, mentioning your experience, and she herself was taking chemo pills and was, talking about working and everything else. But there are folks who are out there, and all over. There's a lot of Americans who are in pretty vulnerable situations when it comes to this virus, and we're trying to avoid spreading it to so many folks, especially since we don't have a vaccine yet. Hopefully that will be something that we can get going soon. And there's been some developments there, which is great. Some from Wash U, actually, right here in Missouri. Some great developments. But we're not there yet. And so voting safely is a pretty important thing to do. There was a big fight about that in the legislature as well. Some changes, the governor hasn't implemented them quite yet. But yeah, it sure seems like we could be doing a whole lot more to make sure folks can vote safely in Missouri.
Yes, there is plenty we can do, and we need to make sure everyone is registered. The deadline is it's June 28th, I believe. I'm going to double check that to make sure you're registered for the August election. So please, everyone, go check your registration. If you moved, or if you're in a new area, please double check your registration and make sure that you are able to vote in August, and that we are able to get Medicaid passed, and that you know where your election site is. Do all that your background research now, and then we will be ready. But of course, vote first. You have to vote June 2nd in your municipal election,
right?
I should say.
Yes, vote for that. Yes, I did check. So I went on, and you could probably see, because we're doing a whole screen sharing thing.
Whole thing.
Yeah, I went. So we've got a website. It's called votemissouri.org. That actually volunteers came to us to put up, because one of our volunteers lived in Washington State for quite some time, and there they do a lot of their voting by mail. And so she came here and heard all these things. She said, "Well, obviously you can vote by mail," and no, we can't. Not very often, at least. There's you have to have an excuse and everything else. So she
get it notarized.
Yeah. Well, she and a whole bunch of volunteers, they came together and helped build the data behind this. But votemissouri.org helps you apply for an absentee ballot and make that request. And so I was just checking there. We have information about the deadline to register. So for the August election, you need to register by July 8th. So make sure to do that. You can do that online at the Secretary of State's website. If you go to votemissouri.org, there's a button there to take you right to the registration. So just check out that website. There's a whole bunch of info on there, and it helps you vote absentee too. If you haven't applied for an absentee ballot for the municipal election that we were just talking about on June 2nd,